Nice. We have folks from all over the state. We have some Medford folks and we have some Eugene folks. It's great. So question for the reporters, is Becky the main thing that you're seeing in your screen? I want to make sure that she's the primary screen. She is in mine, but I got somebody telling me that she's in the gallery. I want to make sure that she's what you're seeing.
I'm seeing you, Dave, right now.
Oh, really?
I was seeing Becky.
Well, that's maybe it's in speaker view, so I'm talking.
Okay.
So when Becky starts talking, she'll hopefully.
Yeah, I saw her.
Yeah, is that
Yes.
the
Yeah.
screen?
Yeah. Okay. Okay. Yeah. Of course. That's how it works. Speaker view needs to be speaking.
I'm being asked to unmute. Is there any particular reason?
No.
Okay.
No. Sorry. So for everybody who's asking me whether it's okay to record, the answer is yes. And then I can also share a recording afterwards. Hmm. I apologize, everybody. I don't know why you don't have a record function on your end. Okay, we're working on it on our end. Okay. Let's just wait one more minute, Becky, and then because we want to try to see if they can record this, and then we'll start. We have a couple stragglers.
I see Lynn has a hand up too.
No, I'm preparing.
Ah, you're just practicing.
No, it's for after.
Oh boy, okay. So Tyson, does that, and I apologize because I should know about, I should know this already, but do I have to click on every participant?
Yeah, so of all the press conferences I've been doing lately, Zoom should have a setting that allows the host to grant permission to all. That hasn't been functioning correctly. And so they've had to individually grant every single person recording permissions, which is a huge pain for you guys, but we sure would appreciate it.
Yeah, okay, let me see. Okay, there's a function that says ask to start video, so I'm going to go through everybody. I'm assuming that's what you're talking about.
No, asking to start video would be asking them to turn on their cameras.
Oh,
There should be a, you just right click on it and it says grant recording permission right on their name. When I've hosted, that's been what I've done. It looks like a lot of reporters are working on alternate means to record this.
yeah, I don't see when I right click on people's names, I don't see that.
And you are the host, correct?
Yeah,
Okay.
Yeah.
Hmm.
huh. All right, I apologize about that. Hopefully you guys can figure out another way to record.
And Dave, is there any way we can record and make it available?
Yeah, we are recording, so I'll make it available to folks, but sorry, we can't do it in real time. I apologize for that. Okay, well, let's get started, everybody. I think everybody's had a chance to arrive, and I can let any late arrivals in, but I really appreciate everybody coming and joining us this morning for Becky Hultberg's news conference. What we're going to do is we're going to use the chat function for questions. So if you want to type those in, and then I will field those and pass them on to Becky when we get into the Q&A portion. And then Becky's just going to speak for a few minutes, and then we're just going to open it up to questions. So again, thanks everybody, and I hope you find this useful at this time. And here is Becky Hultberg, who's the president and CEO of the Oregon Association of Hospitals and Health Systems.
Good morning, everybody, and thanks for joining today. I'm here to talk about the really difficult challenges facing Oregon's hospitals and patients over the next few weeks, and to continue sounding the alarm. So I'm going to make some comments, then I'm happy to take your questions on any of the topics that I cover in these opening comments or anything else that's on your mind. So first, I want to walk through some data that I'll be referring to in my comments. Dave's going to share his screen. We'll show the data. I'll tell you what it is and then pull it off the screen. So Dave, can we go ahead and share that? So this is a dashboard that Apprise Health Insights has created based on the Oregon Hospital Capacity System data. This is updated daily, and it includes a couple of things that I want to talk about. The top graph is current suspected and confirmed COVID patients. And so as you can see, we're over 1,000 today. The middle graph is emergency department patients who are boarding. And we'll talk a little bit about that later. The last graph is patient discharge delays. And these are patients that are in a hospital, but don't medically need to be there. So I'll touch on that as well. So Dave, if you can take that.
Yeah, and I just want to point out to people that in the chat function, there is the link to that dashboard if you want to just click on that and have it yourself.
And also I'll remind you that this is point in time data. So what you see on the screen may be a little bit different maybe than what you hear me say. It just really depends on the point at which we're looking at that view. So today we have 1,059 confirmed and suspected hospitalized COVID-19 patients. That's 74 more than yesterday. Our Delta hospitalization peak was just over 1,200, and we're on track to exceed that peak, possibly by this weekend, maybe early next week. Hospitalizations have been growing steadily, and that growth is accelerating. You can see the increase from yesterday. Last week, we were seeing increases of 30 to 40 patients a day. So if you project this trend out, you can see the real challenges ahead of us. This Omicron surge is different than Delta. Delta hit Southern and Central Oregon harder than other regions of the state, but Omicron is impacting all regions of the state and pretty much all hospitals in the state. The lack of available hospital beds is pushing the system everywhere to a breaking point. There is good news. The good news is that most patients in the hospital with COVID-19 aren't as sick as they were during the Delta wave. But the sheer number of patients, exacerbated by staffing and discharge challenges, has the potential to overwhelm the healthcare system. And I'll talk a little more about those two specific challenges. The next couple of weeks are going to be really tough, and it is important for people to understand that. There is a war going on in our hospitals against this virus that isn't visible to the public. And for the next few weeks, we're going to have one focus, and that's on ensuring that Oregon patients receive the best care possible during this surge. Hospitals need support so they can continue to deliver that care. And I want to take a minute here to thank the governor, who has mobilized the National Guard and secured hospital clinical staffing. We're in a difficult spot, but without those resources, we would be in a far worse position. So I'm going to touch next on a couple of factors that are presenting particular challenges in this surge. The first is the staffing crisis. Hospitals are in a much worse position with staffing than at any prior point in the pandemic. After 2 years on this COVID-19 roller coaster, many healthcare professionals just want off. Staff are physically and emotionally exhausted and dealing with challenging patients and conditions. Nationally, nearly 1 in 5 healthcare workers has quit during the pandemic, so this is not unique to Oregon. Hospitals are also facing significant numbers of staff out sick with COVID-19, just like other organizations. Schools have gone remote, businesses have shut down, but that is not an option for a hospital. These staffing shortages are causing hospitals to rely heavily on contract staffing, which is very, very expensive and not sustainable over the long term. It is essential, though, until the staffing situation stabilizes. So let's talk about post-acute care and challenges with discharge, which was on that bottom graph. Hospitals are one part of the overall care continuum. Right now, that continuum isn't meeting the needs of all patients, and it's making the situation in hospitals far more challenging. Patients often must be discharged from hospitals to long-term care or other facilities to continue their recoveries. And delays in moving patients to these facilities are adding to hospital capacity challenges. So today, hospitals have 582 patients who could be discharged from the hospital, but there's nowhere for them to go. this means that they're not in the best care setting for their needs. They may need a nursing home or rehab bed, behavioral health support, or they may not even have a home to go to. So the reasons are complex, but it is past time to address this problem. Hospitals have been sounding alarm bells for the entire pandemic about the challenges of discharging patients. And we need help in moving patients out of the hospital to free up beds for people in the community who need them. Related to that is the situation around emergency department boarding. Patients are waiting in the emergency department for available beds in the community or in the hospital. We have 229 of those patients today. Some of these patients need a behavioral health bed, others need a medical bed, but the beds just aren't available. And nobody wants to be waiting in an emergency department, which is not the best environment for recovery, but that is the reality for many patients today. And this also impacts the ability of hospital emergency departments to handle the huge influx of really sick patients that they're seeing. So finally, I want to touch on supply challenges. As you all can remember, supply challenges have been difficult since the beginning of the pandemic. In the early days, it was around personal protective equipment, and now it's around other critical resources. There is a national blood shortage crisis, which is also affecting Oregon hospitals. So I want to encourage people to donate blood. We are also dealing with limitations on the supply of monoclonal antibodies and other therapeutics. Hopefully, some of these challenges will resolve over the coming weeks, but these are the things that our hospitals are dealing with in real time. Oregon's hospitals are resilient. Much has been asked of them over the last 2 years, from taking care of COVID-19 patients to leading vaccination efforts, and they've responded. But the pandemic has taken a significant toll, and the healthcare system today is not the same system we had in 2019. So as we approach COVID-19 recovery, whenever that comes, it's going to be really important for policymakers and other stakeholders to recognize the fragility of the healthcare system. So with that, I really want to thank you for joining today. I'm happy to, again, answer questions on any of the topics I covered or anything else that happens to be on your mind today.
And again, just go ahead and type your questions in the chat function and I'll forward them to Becky. Okay, sorry, I just had a bunch dump in at the same time. Okay. This is from Dick Hughes. You described the challenges. What are the specific solutions that you propose?
Thanks for the question. And I think it really depends on which issue we're talking about. First of all, I want to acknowledge that there are no easy problems to solve. And some of the challenges that I'm articulating have been challenges since before the pandemic. And so as we emerge from COVID-19, long-term, I think we're going to have to understand how the care continuum can work better so that we can serve patients wherever they are in their journey. And that's the long-term effort. In the short term, clinical staffing is helping to address the discharge issue. We have made some recommendations. The governor has responded to some of those recommendations. I think it's important to continue to raise awareness of the significant challenge we're having with hospital discharge, and it will be more important post-pandemic to come together to address the challenges we have in our care continuum.
Thanks. And this is from Christian from the Lund Report. Is there anything specific the state should be doing now with regard to hospitals and the pandemic?
That's a very good question, and thank you for the question. I want to acknowledge the resources that the state is bringing to hospitals and to post-acute care facilities. So the National Guard resources and clinical staffing resources have been very helpful. We need to continue to problem solve with the state. That is happening, I know, through the state's incident management team. In terms of specific solutions, there is not one specific solution that's going to solve our emergency department boarding problem or our post-acute care problem. There are probably lots of very small solutions around the margin. Some of those things we're working on today. Some of those things we may propose in the future. But again, I think it's important to raise awareness of the magnitude of these challenges. They are not going to be easy problems to solve, but we're going to have to make a strong commitment, especially post-pandemic, to address them.
This question is from Lynn Terry from the Capitol Chronicle. what impact will the staff contracted by OHA have? And will that be enough?
So again, the magnitude of our staffing challenges is significant. The clinical staff that OHA has secured for our members has made a significant difference. Now, whether, in the future, we're going to have to find ways to return to our staffing models where we employ the majority of our staff and we are less reliant on travelers. That is not the situation today. So I think we need to recognize where we are today, which is a heavy reliance on contract staff. We are appreciative for the support that the governor has provided to get those clinical staff in our facilities. Over the long term, we're going to have to transition away from them and return to more normal staffing models. I don't have an estimate on exactly when that will be, but I think that's the goal.
Here's a question from KPTV. When are we expected to hit the peak, and are we peaking?
So that's a question that is probably better for OHSU's Peter Graven than for me. The last data I saw was that we would hit a peak. It was either late January or early February, and I apologize for not having specifics on that, but I certainly can get that information back to you. January 28th, someone responded, so thank you.
Question from Pat Doris of KGW. What is your solution to the backup of patients not being able to get into long-term care?
Pat, this is a really complicated problem. I think as we look at the challenge today, we need to do everything we can to facilitate discharges of patients to hospitals, whether that is continuing to work on decompression units that the state has set up, whether that is looking at other discharge locations that are more interim. That needs to be our near-term solution. Over the long term, I think we're going to have to look at the care continuum and identify where is that continuum breaking down? Who are these patients that we're not able to discharge and why? Is it because they don't have the right insurer or that the nursing home doesn't take their insurance? Is it because they don't have a home? Is it because they have a behavioral health problem and so the nursing home won't take them? Those are the kinds of questions that post-pandemic we're going to have to understand better, and then we can begin to create solutions.
And Becky, for folks who aren't familiar with the decompression unit, can you explain what that is?
Sure. The state has made an effort to increase the discharge locations for patients by essentially contracting with some nursing homes to set up units specifically for discharge from hospitals. But in those facilities, patients still have to get approval by the nursing home. So there's still the process of accepting their payer and accepting them from a clinical standpoint. So they're a part of the solution. They are not the whole solution.
Another question from Larry Noble. You spoke to Oregon's hospital situation statewide. Can you share any specifics about what the next couple of weeks may look like in Southern Oregon specifically?
I think the good news is that Southern Oregon is not seeing the same type of crisis that the region saw during Delta, but hospitals are still very, very full. So I think as we approach the next few weeks, it's going to be important to recognize the strain on those facilities. And I think it's important for all of us to continue to do the things that we know work against this virus to help over the next couple of weeks. That is masking, ventilating, vaccinating, and distancing. But specifically with respect to Southern Oregon, I think this surge is different. This is putting more pressure on emergency departments and regular medical units, whereas the Delta surge put more pressure on ICUs. And so how that translates into Southern Oregon, I think remains to be seen over the next couple of weeks. But again, the Delta or the Omicron surge is affecting hospitals really statewide, much more so than Delta.
Here's a question from K-Val in Eugene. Is there a shortage of monoclonal antibody treatments that are specific for Omicron, and how is that being distributed?
So the state makes those allocation decisions, but to answer your question, yes, there is a shortage of monoclonal antibodies that are effective against Omicron. There's also a shortage of Paxlovid, which is the other treatment that is in a pill format that is effective against Omicron. So hopefully the supply of those treatments will improve over the coming weeks, but we are in a situation where supplies are constrained.
Here's a question from Fedor Zarkin from Oregon Live. Can you please quantify the staffing shortage? You said 1 in 5 healthcare workers nationally have left their jobs. What's the situation in Oregon?
You know, we don't have any reason to believe that Oregon is different than the trends we're seeing nationally. I don't have data specific to Oregon hospitals. Individual hospitals do keep data on their vacancy rates and traveler usage.
Here's a question from Annette Newell. Becky, at this point, is it inevitable that hospitals will run out of ICU beds?
You know, the pressure in this surge is a little bit different. We do have hospitals where ICU capacity is a significant issue, but the pressure in this surge is more on hospital emergency departments and general medical units. We're seeing patients that are not quite as sick as they were during Delta. And so when we're looking at capacity challenges, it's not just the ICU, it is the emergency department and general medical units. So I don't want to say it's inevitable that anything's going to happen, because anytime I've made a prediction during this pandemic, it's been wrong.
Here's a question from Nicole Montesano that actually relates to the topic that you were just speaking to. There have been reports that fewer patients need ventilators, but that deaths are going up due to strokes and similar issues. Can you address that?
You know, I'm not a clinician, so I don't want to speak to the specific causes of death in hospitals. I can tell you that, again, this surge is different, and we are not seeing the ventilator usage that we saw during Delta. Now, whether what is causing COVID deaths, I think, is probably a question better for a clinician or someone at OHA, but we are not seeing the intensity of resources on the critical care side that we did during Delta.
Thanks. A question from Coin6. Would you like to see more National Guard troops called up beyond the 1,500 for help in places like long-term care?
So our National Guard capacity is limited, and we owe a really great debt to the Guard for the service that they're currently doing in our hospitals. Do we need more staff? Absolutely. We need more staff in skilled nursing facilities and in hospitals. Is the National Guard the solution to those staff problems? I don't think I can say that definitively.
Question from Rachel Monahan of Willamette Week. Massachusetts is using dexamethasone, I don't know if I said that right, prescriptions to monitor cover being the reason for hospitalization versus cover being incidental. Any idea of what percentage of patients are on oxygen or on dexamethasone?
That is not a question that I can answer, but we can probably find a clinician who could help you with that.
Okay, yeah, Rachel, I can get back to you on that one. Vicki Aldis, for everyone, hospital capacity is consistently at 97 to 98% in the Portland and Salem healthcare regions, and 93% so far in Medford, Grants Pass. What would be normal capacity, or to put it another way, the capacity that could be handled well by hospitals? And that's Vicki Aldis from the Medford Mail Tribune.
Yeah, and thanks. That's a great question. It's certainly going to be a lower number than the numbers we're seeing now. I think it's probably going to be dependent on unit, and so I really hesitate to make a broad generalization about what capacity would be considered normal. Happy to try to get more information from hospitals on that, but again, without understanding a little bit more, I think I'll defer that to some of our capacity experts and be happy to follow up with you on that.
A question from Elizabeth Hayes of the Portland Business Journal. Do you anticipate that crisis standards of care will be implemented in the next few days?
So Elizabeth, good question. And as you know, and many of you know, crisis standards of care has been a big topic recently and has been a challenge throughout the pandemic as we've faced situations in our hospitals that we hoped never to face. Now, I hesitate to make a prediction. Again, it's a really hard environment in which to make a prediction because we just don't know for sure where this surge is going to take us. We can look at models and we can project ahead, but we don't have certainty. I will note that critical care resources are not as constrained during Omicron as they were during Delta. and the state's crisis care guidance does point to critical care resources. So it remains to be seen. And I want to emphasize that our goal is not to get into crisis standards of care. So our hospitals are focusing on how to distribute patients and resources so we can avoid that scenario.
Here's another question from K-Val in Eugene. Rural hospitals are telling our newsroom that they're facing a major shortage because the bigger hospitals are offering them more money. I'm assuming we're talking about staff. An example is travel nurses. What is your response to that as it regards to the overall worker shortage?
So there have been differences between urban and rural communities around staffing for a long time. This is pre-pandemic. The question, as I understand, is specifically related to travelers. There is a huge demand for contract staff right now, and those contract staff are going to the places where their agencies can receive the highest reimbursement. So is that putting some rural facilities at a disadvantage? We have heard that it is harder for rural facilities to secure contract staff. How do we address this challenge? Long-term, we need to increase the pipeline so that we have more workers available to work in our rural communities. And I think programs where you can grow your own workforce at home and people can train in their community and stay in their community, obviously are the best solutions. Is there a short-term staffing shortage? And is it impacting rural hospitals and their ability to get agency staff? Absolutely. So Dave, I want to just take a minute because there was a question around normal hospital capacity, and I didn't phone a friend, but somebody did ping me with the answer. And so let me respond to that really quickly, and then maybe we can move to the next question. So on average, capacity is about 60 to 70%, depending on the unit during what we would consider a normal time. And so if that gives you kind of an idea of the order of magnitude of when you see capacity numbers in the 90% range, normal capacity would be 60 to 70%.
Great. Another question from Rachel Monahan. How many hospitals at this point have canceled elective surgeries?
Rachel, I don't have a specific number of hospitals that have canceled elective surgeries, but it is fairly widespread at this point. Many hospitals are really managing elective surgeries on a day-to-day basis, trying to fit in the ones that are most critical and delaying the ones that can be safely delayed. So if you think about elective surgeries, and I just want to remind us all that, elective may mean a cancer surgery or a heart surgery that can be delayed. So it's really important to keep those surgeries going while we can, but certainly the number has been curtailed, and many hospitals are on a day-to-day basis in terms of what elective surgeries they're performing.
So there's a couple questions on topics that you've already touched on, but I'll just read them. Should the National Guard be deployed to nursing homes? I think you addressed that one. Unless you want to speak to that specifically.
If there's more detail, please let me know. But if,
and then let's see, Lynn, Terry, do you expect hospitals to have to activate crisis standards of care? And then from Rachel, are hospitals satisfied with the way extra resources, contracted staff, National Guard are being allocated to specific hospitals? How is that being decided on which hospital they go to?
Yeah, good question, Rachel. I think the process of how hospitals work together and how the hospitals work with the state has evolved over the pandemic. And actually, I think we have a pretty successful way for resources to get allocated across the state. We are working very collaboratively with our regional resource hospitals and with the state's incident management team to disperse staff where they're needed and then to redeploy them if necessary. So earlier in the pandemic, as we were learning how to do this, it was the going was a little more rough, but I think today things are actually working pretty smoothly.
Okay, another question from Christian of the Lund Report. Do you expect demand for ICUs and other critical services at Oregon hospitals to exceed capacity and for hospitals to have to begin rationing? So yeah, we're kind of a different ways of asking a similar question, but rationing, triaging these critical facilities and services, and when might that happen?
I wish I had a crystal ball and I could make that prediction. I think the goal is not to get into crisis standards of care and to continue providing every patient with the best care possible. That is going to be the goal for the next few weeks. I think on an individual hospital basis, it's really going to depend on how the hospitalizations increase over the coming weeks. So it's really hard to predict. We potentially could see hospitalizations that exceed our Delta peak and really strain hospital capacity. You know, that's what I'm here telling you today, is that things could get really tough. Whether that means that hospitals invoke crisis standards of care remains to be seen.
Question from Amelia Templeton of OPB. Do you have any additional data on who those boarders are? Who is the hardest type of patient, most difficult to place in a nursing home right now?
So Amelia, one of the challenges that we have is that we don't necessarily have good data about those patients. We have anecdote. And so let me tell you the kinds of patients that are hard to place. A typical patient could have an insurance that the nursing home that's available doesn't accept. So payer issues continue to be a problem. We have patients with behavioral health challenges, and many skilled nursing facilities don't want to take those patients. So we also often have patients that are unhoused, and so there is no safe place to discharge them. And so one of the really important things I think following this surge is for us as a healthcare community to better understand the patients that we're not serving well and make sure that we are making plans to bolster the care continuum so we can meet their needs.
Another question from Fedor. What specifically are you asking the state or public to do differently, if anything, for the trend you are describing to change?
You know, it's going to be a challenge to change the trajectory of the trend in the next week or two. But if we look out beyond that, we do have the power to continue to influence the number of hospitalizations in our facilities. So again, for the public, it is the things that we have talked about and that people already know. Mask, vaccinate, ventilate, distance. You know, those are the things that continue to be so important in helping us to avoid a hospitalization crisis.
This is a clarification question from Lisa Balick at COIN. Is the surge in hospitalizations from patients who have underlying conditions and hard hit then by Omicron, since, as you said, critical care resources are not as needed as they have been in the past?
So I think what you're talking about is, are people hospitalized with COVID or because of COVID? And we've seen those conversations occurring across the country. And, you know, COVID can manifest itself in a hospitalization in two ways. It can be someone who is completely healthy, gets COVID-19, it hits them really hard and they end up in the hospital. That is happening with Omicron. Or it can be that they have an underlying health condition, such as heart failure, that is exacerbated because they get COVID-19. And so I don't have a breakdown in Oregon of hospitalizations because of or with COVID-19. But whether it is someone hospitalized with COVID or because of COVID, it is still a hospital bed that is taken up that might not have been in use were it not for COVID-19. So I think those distinctions are not, when we're at peak hospital capacity as we are today. The real issue is not why the patient specifically is in the hospital, is that there are no more hospital beds available.
Question from Fedor. Approximately what percentage of patients hospitalized with COVID came for treatment or other issues and tested positive incidentally? You were just talking about that. I don't think we know that number.
We are not, you know, I think it is Massachusetts that has began to track those numbers. To my knowledge, we are not currently tracking those numbers. So I don't have a data point to give you.
And then I'll just interject for folks where I've said, we'll get back to you, or if Becky said that, send me an email after just to remind me. I'm trying to make notes of those I need to circle back to, but just remind me what your question was. Here's one from Christian from the Lund Report. This is for after the pandemic discussion is over, but we'll take it now. What is the OAHHS legislative agenda for the upcoming Oregon session? Highlights of what you anticipate supporting and opposing.
Sure, and I actually do think this is related to COVID-19 because it goes back to the fact that the healthcare system in 2022 is not the same healthcare system that we had in 2019. And so I think one of the most important things that we can do in the 2022 legislative session is to recognize the fragility of the healthcare system and its ability to absorb any additional change and to not do anything to put additional pressure on the system. Longer term, I think the challenge that we're going to have is understanding the impacts of COVID-19 on the healthcare system and ensuring that the policies that we passed prior to COVID are still the right policies in a post-COVID world.
So I don't have any more questions in the queue. If anyone else wants to pop one in right now, here's your chance, but otherwise, let's see. Oh, here's Amelia. Is there a better frame for this than have we entered crisis standards of care or not? We already have a blood shortage, staff returning to work after just 5 days, rationing of drugs.
Sure. Yeah, and so crisis standards of care is a specific legal definition that OHA has now created. And so I think there is a specific threshold and a trigger for reaching crisis standards of care. We are obviously in an environment where care may look different than it did before the pandemic because of staffing shortages or other things. That doesn't necessarily trigger crisis standards of care. And I think we can follow up with the specific triggers or more information on how that is defined in the rule, but there is a specific definition.
Here is a question from Christian. Which legislative initiatives do you anticipate could put pressure on the hospital system?
Well, I think one of the legislative initiatives that's already putting significant pressure and that we are trying to address through legislation is the Mergers and Acquisitions Bill, which is a huge and complex piece of legislation passed last year that's going to have far-reaching and I think negative impacts on the system. And so at a time when we probably should have been taking a pause on major policy, the legislature passed a bill that is going to have negative consequences. Now, in terms of this session, I don't want to speculate about what might get passed or might be proposed, but I think the general message is the ability of the system to adapt to change, to any new change, is very limited, and we need to take some time to understand the impacts of the pandemic on the system that we have today, not the system that we had 2 years ago.
Question from Vicki from Medford. Are hospitals allowing COVID positive workers to stay on the job with no or minor symptoms? And if so, how widespread is this practice?
I have not had any specific conversations with hospitals about this issue, although there have been media reports of this. And I just wanted to emphasize that hospitals are in a very challenging situation with respect to staffing. And so hospitals are at times being forced into decisions that would not be decisions that would be necessarily the optimal decision under normal circumstances. These are not normal circumstances. Hospitals are struggling to find caregivers to take care of the patients in their facilities, and they are making the decisions on a day-to-day basis that are the best that they can under the situation they find themselves in.
Okay, here's one from Rachel. Did hospitals make more profits or less during the last wave? Do you expect that to be the same during this wave?
So Rachel, we're happy to follow up with some financial data. For the last 2 years, hospitals' operating expenses have regularly exceeded revenue. And so that's not sustainable over the long term, and is one reason that I say that the healthcare system is far more fragile today than it was 2 years ago. So expenses during the pandemic have risen dramatically and revenue has declined. So the financial situation for hospitals will be a challenge moving forward.
Okay, any other questions? Oh, okay, from Nicole Montesano. Could you elaborate on the need for ventilation?
That's just I think a public health best practice that we all know that when that it's safer to be outside than it is to be indoors in an enclosed space. Ventilation can help make environments safer. And so again, just a good public health practice related to COVID-19.
Here's one from John Murray. Becky, you mentioned workforce initiatives that would allow healthcare students to train in their own communities and go on to work in their own communities. There may not be any bills in the short session, but have you seen any other Oregon bills that would implement this practice?
So I'm not going to speak specifically to this particular practice, but there are some workforce bills in the short session that I think could be consequential. The governor has a workforce proposal in the short session, and Representative Prusak has a proposal specifically related to the nursing workforce. So we're going to be supporting those, evaluating those, and then moving forward, we'll be looking at other ways that we can support good public policy to increase the healthcare workforce over the long term. That is what will solve our staffing situation, is encouraging young people to go into healthcare professions, to train more healthcare professionals, to ensure that we have the infrastructure to train them, and that will be our focus moving forward.
Question from Rachel Monahan. Are hospitals now recommending that all staff wear N95s? And that's a cost. Is it worth it to hospitals?
So Rachel, I think hospitals are following guidance produced by OHA and CDC around appropriate masking. I don't specifically know what individual hospitals are doing beyond that guidance. I have not heard that they're requiring staff to wear N95s. But again, they're following the guidance that is made available to them by the public health authorities. All right, well, doesn't seem like we have any more questions coming in. Just want to thank everybody for joining us. Hope this is useful to you. If it's been useful to you, let Dave know, and we can try to do these more often. But I appreciate everybody attending today. I don't mean to cut off questions. If people want to continue to put questions in the chat, go ahead.
Yeah, and I will get the video recording out to everyone who attended. And thanks for your patience in the whole recording issue situation that we had at the beginning. So thank you everyone for joining us. And as Becky said, maybe we'll do this again. Have a great day.